It is Saturday, May 8th at 9 a.m. and my patient is due to receive 25 milligrams of metoprolol. Um, so before going to the Pyxis, I need to assess the patient, ask them if they have any allergies, do pre-assessments, and check for any contraindications. With metoprolol, you need to assess the patient's blood pressure and apical pulse. Parameters that are set for us, we need to hold the medication if the systolic blood pressure is less than 100, if diastolic blood pressure is less than 60, and if heart rate is less than 60. Also, when I'm assessing the patient, I need to make sure that they have something to drink. Now I'm at the Pyxis with the MAR. I log into the Pyxis. I find the patient's name, match it up with the MAR, with name, MRN number, MRN, and date of birth. And then I find the drug, and here's where I do my first check. Checking the drug, metoprolol, the dose, 25 milligrams, the route by mouth, the time, 9 o'clock, and the reason based on my pre-assessments. I also did dosage calculation for this. There are 25 milligram tablets, so I will be getting one 25 milligram tablet of metoprolol. So after doing my first check, I can get the drug, hit enter, it'll dispose, I get it out, and I perform my second check, making sure it's the right drug, metoprolol, right dose, 25 milligrams, right route by mouth, right time, 9 o'clock, and right reason based on my assessments. I also need to check the expiration date, make sure that it's not expired. It is not. I place it in the cup, and now I'm ready to go to the patient's room. So entering the patient's room, I perform hand hygiene. Hello, Mr. Johnson. I have your metoprolol here for you. This is your blood pressure medication to help keep your blood pressure low. And I need to check the patient's ID band. You state your name and date of birth for me, and I'm matching it with the MRN, date of birth, and name on the MAR. Thank you. And do you have any allergies? No? Okay. And then this is when I do my third check in front of the patient, checking the right medication, metoprolol, right dose, 25 milligrams, right route by mouth, right time, 9 o'clock, right reason based on my pre-assessments. Need to make sure the patient is in an upright position that's safe for swallowing. So I raise the head of the bed. Mr. Johnson, would you like me to put your medication in the cup for you? So I will open the medication into the cup, hand him the cup, hand him his water. And while he's taking the medication, I can take this time to teach the patient about metoprolol. For instance, for home use, you need to be regularly checking blood pressure and heart rate and keeping a record of it. Also teaching them signs and symptoms of hypotension, like lightheadedness and dizziness. Also instruct the patient to change position slowly, as this medication may cause orthostatic hypotension. As soon as the patient is taking the medication, I will chart it, perform hand hygiene, and come back and check on the patient in the proper time for medication effectiveness.